I'm Professor Mahmudur Rahman. I was the director of the Institute of Epidemiology Disease Control Research for about 12 years. My responsibility was to undertake disease surveillance in the country, outbreak investigation response, and also training and research in the field of public health. So one of my major activities was also to implement practice One Health in the country also. So we had reports of some crow die-offs in one part of the country, in the northern district. We have different type of surveillance system in place. We have an event-based surveillance in place. So the event-based surveillance where we have 24/7 telephone open for any sort of reporting, and also we do media monitoring. And so in that case, the premises where these crow dives were there, they reported us directly, telling that these are happening. So after that, we decided that we should institute an outbreak investigation. So we invited the Department of Livestock people, and also the wildlife people. We all together set up a team, and this was a major undertaking for this sort of outbreak investigation involving all the departments very well. Though we did in the past also, but this was quite big. And in that case, the human health did their part of the work looking for suspected cases, if there is any, in the areas where the crocodiles were there. In that area, we had a hospital where we had a sentinel site on influenza, and we also looked into the recent sample collection to see that whether there is any positive cases or not. But the animal health people went to the live bird markets and also looked into around that whether there are deaths of other animals or not, and also what are the practices there, why this has gone to the crows, how it has gone to the crows. And there was a group from Eco Health Alliance, so they looked into the wildlife type like the crows and other birds, other animals, wild animals. So we worked together, came back, and then shared our experiences. We confirmed that it was H5N1. We worked together since 2005 when we started working on pandemic influenza preparedness. So all the three ministries, human health, animal health, and also wildlife people, we worked together to develop our pandemic preparedness plan. And subsequently, when our country had H5 in the poultry, we were collaborating with each other very closely. We had, from our human health side, we had a surveillance system in place. Whenever there was an outbreak in the poultry, they were reporting us. Our local health authority were working side by side with the animal health people when they were doing the culling, and also listing the people who came in direct contact with that infected farm. All those people were followed up for 14 days. That continued for some time when there was a lot of outbreaks in the poultry sector. So this is not only these two departments. There were about 17 ministries involved in this whole process. Initially, during the pandemic period, we were having these regular meetings at the ministerial level also, and the multisectoral task force, and also at the National Advisory Committee, which is the highest body where the ministers come in. It was very active at the H5 period, even before the pandemic. And also this was very active in 2010 when the anthrax outbreak was there in our country. We want that the Department of Livestock should go for vaccinating the cows and goats in that area so that the human cases doesn't occur. So that was a need also for us to work with them together. FAO has got some activities, the four-way linking activities to involve all the laboratories together, and also these are the driving force. The most important challenge is the changes of people. If somebody is changed in the counterpart, that becomes a new thing to start again. for about 12 years, I was heading the institute. So there was changes was not on this side, it was on the other side. But we had to manage somehow so that we orient them so that they understand. The other challenge is that, as I mentioned, that all these activities, what happened was to some extent not on a regular basis. Though these are happening, but these are mostly in a situation when there is an outbreak or when there is a crisis. But something has to be there in place where it can happen on a routine basis. It happens, but not in a regular fashion. That's the reason the question of sustainability sometimes comes up. We are functioning, as you know, that since 2005 we are working closely with the Department of Livestock. So one good thing has happened, like we have come up with our One Health strategy document, and that is in our website idcr.gov.bd. You can access that. And subsequently now we have set up our One Health Secretariat, and this has been agreed upon by all the three ministries. Three means human health, animal health, and also we have got fisheries and livestock, and also environment and forest. So everybody agreed where it should be housed and how it should function. We have set up those methodologies, like we wanted to have secondment from the other ministries. So Ministry of Fisheries and Livestock has already seconded one person, and the forest and environment is in the process. So all the three departments will be working this in the secretariat. So they will coordinate the whole thing and also act as liaison between these three departments. In the coming days, in the future, this can be rotated. Otherwise, the ownership will not remain within the other departments. Maybe 3 years, 4 years, it can be here. We want that this secretariat should really work as some sort of catalyst. Is not they will be undertaking some activities. They might undertake activities like helping developing some documentation, developing some strategy documents, developing some SOPs, those sort of activities, not getting into any sort of policy decision making issues. But they might bring in the information those are available so that policy briefs can be prepared and policy decision making can be made on the basis of this. So we hope that in future the challenges what we faced, though we have overcome a lot, but things will be streamlined more in the coming days. One big challenge which is still there, which needs to be resolved, that where the budget is going to come for all these activities, because these are three ministries and three different ministries has got different budget allocation. Ministry of Health will not allocate fund for Ministry of Fisheries and Livestock. So that has to be resolved somehow. We are thinking how to do that. So that is a big challenge in front of us now. We have to find out a mechanism how to do that. I believe that something could be done, but obviously the department will do their own work, but we need to collaborate with each other. We have started a field epidemiology training program, FETP program, where we have taken 2 veterinarians from the Department of Livestock in our program. Not only that, we ran a master's program in MPH and One Health, supported from Massey University. That was a 2 years course. At the same time, I would like to bring that, formed a One Health forum like activities. This is not a government activity, from the people who are dedicated for this type of activities. Since it is about almost 8 years, we are working in that. So we say One Health Bangladesh initiative, where I myself is one of the joint coordinator of that activity, and we meet on a regular basis. We conducted conferences, several conferences, 8 conferences so far in the country, and these are some of them were at an international level also. International level means it's a national, but we invited international people in the conference, and there were scientific presentations. I think each country will have to decide according to their situation, obviously. And I believe that if there is a body who can coordinate the activities of different departments, because currently what is happening, everybody is working in a silo. I see in different countries they work separately. They don't talk to each other also. So that culture should change with this One Health approach, because the source lies maybe somewhere in the wildlife or in the animal health. So this needs to be taken care of well. So in that case, especially in the early warning system, that helps a lot. And not only that, some of the research activities which should be undertaken on a collaborative manner will be much helpful also to find out what is happening. And also, this is not only due to these emerging infectious diseases, like if you talk about foodborne illness, you talk about antimicrobial resistance. This has become more important now to share with each other, that if they find any resistance in the poultry sector, they should report to health sector. Not only that, some measures should be taken also. As you know that in the poultry sector, for their feed, they use as low dose antibiotics. So that if comes in the food chain, gets resistance in the human. So this sort of activity needs to be strengthened very well. And I believe that, as you said, that whether other countries should do that, if they have to work together with the other departments, this sort of institutionalization, having a One Health Secretariat might be helpful. If I give an example of the primary healthcare, it was an approach. So One Health is also an approach. This approach needs to be familiarized well, and this needs to be, practiced well, so that we can go to the source of the infection, so that we can resolve that very quickly. That is the idea about. It is not like a disease is coming and we are treating that. It has to go to the source infection. That has to, all the departments should work together, especially human health, animal health should work together to go to the source, and so that that can be contained at source, so that it doesn't spread much. And actually developing the capacities within all these departments will be helpful for the future, for the human health, animal health, both.